previous modules, you've learned about opioid use disorder, OUD, and the science of medications for OUD. In this module, you'll learn more about your role working with individuals to help initiate treatment and encourage engagement with MOUD. If you were to step back and take a 100-foot view of the role of the probation officer, you'll see it's to protect public safety. Protecting public safety can happen several ways, including connecting individuals on probation with resources based upon their needs. This improves an individual's health, well-being, and social and financial capital, which can translate into more stability for them and increased safety for the community. This means one of your primary roles working with individuals on probation includes assessing individuals to determine their needs, taking that information and working with them to build a case plan for their time on probation. Then spending your time checking in on them, ensuring they're following up with the referrals you gave them, engaging in treatment and programming, and staying on track to complete probation successfully. Although we recognize there are a lot of barriers out of your control to doing this work well, there are still several components that are under your purview that make you an integral part of an individual's journey on probation. As you've learned in earlier modules, substance use disorder is a critical concern for many people on community supervision. Researchers estimate nearly 60 to 80% of individuals on probation have a substance use disorder. Limited data makes it hard to estimate the number of individuals with an opioid use disorder on probation. However, remember that we do know around 71% of drug-related overdoses are related to opioid use. This means that approximately 75,000 people die per year from opioid-related overdoses, resulting in experts describing the current circumstances as, quote, the most lethal drug epidemic in American history. While we may not know exactly how many individuals on community supervision have an OUD, a national survey of drug courts provides some information about the primary use of opioids. In suburban drug courts, respondents reported 34% of their participants primarily use opioids. In rural drug courts, respondents reported 31% of their participants primarily used opioids. And in urban drug courts, respondents reported 22% of their participants primarily used opioids. As you can see, opioid use disorder is a critical concern for individuals on probation. While opioids may not be the primary substance used by the individuals you supervise, knowing how to address the treatment needs for those who do have OUD is very important. As part of your work with individuals, you must understand their relationship with opioids. And, as you learned about in the last module, screening and assessing is one of the first stages of the behavioral health services cascade, where the PO is very important to identifying the potential needs for treatment specific to OUD. In the last module, we reviewed the difference between a screener and assessment tool. Remember, most of the assessments used by community correction agencies vary drastically about the types of information they collect. As a result, these tools like the LSIR, Compass, or ORAS are actually tools that can be described as in between a screening and a full clinical assessment. Assessment results from the Compass, ORAS, and others are not meant to diagnose individuals, but to help the PO or other supervision staff make appropriate treatment referrals based on an individual's needs. Identifying early if opioid use is present for a person on supervision helps the officer make a more informed decision about a treatment referral. Remember, treatment approaches are not one-size-fits-all, and that some providers are better suited to address opioid use. Depending on the screener or assessment tools used by your agency, you may need to approach collecting information about opioid use differently. First, your agency might have specific opioid use questions formally built into the tool or tools you use at initial intake on probation. Second, your organization might have substance use disorder questions in a tool, but not opioid use specific questions. In this case, you'll need to ask follow-up questions about opioid use specifically. Or, your process might not include questions about either substance or opioid use, and you'll need to follow up with the individual directly. Additionally, Each agency varies related to who administers the screening or assessment tools. For some agencies, this might be an intake probation officer, and for other agencies, the probation officer might administer all tools. It's especially important if your agency delegates these tasks to an intake officer and it does not ask specific questions about opioid use, that you include these questions in early conversations with the individual on probation. Remember that this early recognition that opioid use could be an issue for the individual will help you make a more accurate referral early in the process. Each screening or assessment tool produces various types of results and scores. Sometimes these assessment tools' results can be tricky to unpack because they're full of academic jargon and complicated to translate to individuals on probation. These are common concerns about agency screening and assessment tools and results. Even with these concerns, it's still possible for you to develop with the individual on supervision a comprehensive plan for their success. If you determine the individual you're working with has a potential issue with opioid use, then consideration of OUD treatment, including the potential for MOUD, should be a critical part of their case plan and the first referral. However, prior to making this referral, you may need to work with the individual to understand more about their concerns related to OUD treatment, especially MOUD broadly. Some individuals recognize they'll test positive for some opioids and are concerned this might not meet the condition of probation around substance use. More importantly, they may be concerned that a positive test will result in a probation violation and return to court for them. They may be highly skeptical of engaging in MOUD for this reason. Some individuals might be currently engaged with groups like Alcoholics Anonymous or Narcotics Anonymous that are more likely to support abstinence-based treatment. They might believe MOUD makes them ineligible to continue engaging in these groups. Or they might be fearful they'll experience stigma related to MOUD from their sponsor or others while participating in these groups. Remember the video from Module 3 that provided an example of this and the potential solutions for helping the individual through this. Other individuals might have an aversion to medication or receiving medical care more broadly. People of color are generally more resistant to medical care and therapeutic medications because of historical exploitation of these communities by the medical community. For others, they might be fearful of medication therapies because they're pregnant or might soon become pregnant. There are many barriers that may make the individual hesitant about medication treatment. Before referring an individual on probation for MOUD, it's important to take time to discuss the concerns related to medication. You're a key person to help answer questions related to MOUD and the individual's conditions of supervision, and you can also help the individual create a list of questions better suited to ask a provider. Consider using the handout provided in Module 3 to help the individual write down questions for their CP. Once you're able to allay their treatment concerns, including the potential of MOUD, it's time to assess which program might be best for them based upon the provider who can address most of their needs in a way they prefer. This does not mean this is the ultimate provider they would use, but it's at least a place for the individual to begin with your guidance. Just like any other treatment, not all MOUD treatments are the same. This requires a bit of matchmaking with the individual to find the most appropriate and responsive program. It's important to understand what MOUD providers exist in your community, the types of medications they offer, the modes they offer them in, their eligibility and enrollment requirements, what insurance they accept, the languages spoken by staff, what other programmatic components they offer, and where they're located and how accessible it is to the public transportation that is offered in your community. For more ideas about helpful information to know about providers, see the Inventorying Your Local MOUD Provider handout. Equally important is to understand more about the individual you're working with, their history with MOUD, and what they would want from a provider. This includes asking them questions about any past experiences with MOUD, what specific medications they previously took, if any, and how they responded to them, how they prefer to take medicine, and what would help them stay compliant with taking medication when they last used opioids or any substances, current insurance, their access to reliable transportation, and in what treatment supports they're interested. For more ideas on what you could ask individuals, see the Understanding Individual Preferences handout. Based upon what you know about community providers available and the individual's history and preferences, you can identify the most appropriate community provider for the individual's referral. The goal here is to try to match the individual's needs and preferences to the provider that is most likely to be able to meet those needs. As a PO, we're not expecting you to make diagnoses or determine a specific treatment pathway for the individual, such as a specific medication that is best. Hopefully, through the information you've gathered, you can help the individual make an informed decision about their best match for a community provider. Then, through an active referral process, you can support the individual's initiation and engagement with the community provider. This matchmaking process is an ideal scenario and assumes very strong inter-organizational relationships between your agency and those in the community. A very real concern is the quality of existing relationships between your agency and community MOUD providers, if there are any at all. It's understandable that you might not know this information about all or even many MOUD providers. You might consider how you and your colleagues can piece together the information each of you knows about various providers to build a repository, or troubleshoot other ideas to collect this information. While responsiveness to the individual's preferences in an MOUD provider is the priority, it's understandable and a reality that they'll need to be compromised based upon what's available to them. As you discuss with them the referral you're making, find ways to connect their preferences with what the provider offers and acknowledge the ways in which you cannot meet their preferences. A very real barrier to being as responsive as possible is the lone provider concern. It's still important to know the individual's preferences, even if you already know where you plan to refer them. This will help you understand areas that might be of concern while they're initiating and engaging in MOUD or any other type of treatment, and might come up again to explain potential noncompliance. Importantly, it will help you talk with the individual during the referral process to manage their expectations and prepare them for what to expect. Find ways to connect their preferences with what the provider does offer, and spend time acknowledging all the ways in which the provider does not meet their preferences. This will help manage their expectations and can go a long way in acknowledging what they might struggle with in treatment engagement. This is also a great opportunity to build a real, supportive working relationship. While there are several other considerations in the referral process, we'll highlight 5. First, securing insurance. Some of the individuals you'll work with will have private insurance through employers, partners, or family members. Some might have insurance through the VA or Medicaid or Medicare. Others might be uninsured but eligible for state assistance. Some individuals might be returning from custody and have lost their insurance. You'll need to check in with them about their current insurance needs, and if they don't have insurance currently, then their history navigating this process. If they don't know how to navigate this process, you'll need to provide additional support considering their options and completing insurance paperwork. Based upon the enrollment criteria of the MOUD provider, you might have to help prepare the individual you're working with. This might include helping them navigate seeing a PCP first and developing a plan to not use opioids or substances 12 to 24 hours before the start of the program. Although the community provider might also help them navigate these initial steps, it's important to be aware of the community provider's role and what they do and don't do early in the process. This will help ensure the individual is eligible for the program you're referring them to and set expectations about the steps required in MOUD initiation. You might consider referrals to MOUD providers that also offer other resources, such as recovery support services, such as peer specialists or wraparound services. Referrals to these programs and providers should be considered in tandem with availability in the community and the individual's preferences, needs, costs, and insurance. You might also need to work with the individual on their own shame and perceived stigma of their disease and using medications to treat their disease. You might need to be prepared to discuss the evidence around MOUD and tackle some of the same questions you may have initially had about MOUD. These could involve general questions around MOUD myths and choices they'll have to make. Remember, the handouts from Module 3 can help you to answer these questions, or help the individual develop the questions for their community provider to address. You should also prepare to have this conversation several times, as the individual you're working with may not initially be ready to initiate treatment at all, or may be very resistant to medication specifically. You might consider adding other individuals with MOUD experience to early conversations to build credibility of the treatment and provide a community of support once the individual initiates MOUD. These are potentially areas that you could partner with community partners to build supports for the individual you both work with. Nonetheless, tapping into the shame or perceived stigma that is working in the backdrop for the individual will be important for helping the individual follow up on the referral you make. Individuals on community supervision come from a range of background and experiences. They are white, Black, Indigenous, Asian, and bi and multiracial. They span multiple age ranges and vary in gender identity, sexual orientation, and global ethnicities. For many individuals involved in the criminal legal system, they have also been historically excluded from receiving health care, or when they do receive it, experience direct and implicit bias in the process. For example, when thinking about individuals on probation who are people of color, it's important to consider the difficult history these communities have had with the medical community. Only about 10% of all individuals with substance use disorders seek treatment, and this is substantially less for people of color and within communities where there is historical mistrust of healthcare and social services. Ample evidence suggests doctors discredit the pain experienced by people of color. Doctors recommend less rigorous or comprehensive medical plans, and doctors have coerced patients of color without their full understanding into treatments that have had life-changing implications. This includes doctors working within the legal system and in their communities. Following up with a referral to see a special doctor might be commonplace for you. However, for those with a personal history of experiencing discrimination while seeking medical care, such as racism or transphobia, following up with an MOUD provider can be fraught with even more stress and uncertainty. Failing to bridge sociocultural divides can contribute to not initiating treatment, noncompliance, and prematurely leaving treatment. Given that there is a shortage of doctors of color or trans doctors in general, and specifically among MOUD providers, engaging individuals in culturally responsive treatment can be very difficult and fraught with stress and uncertainty. Remember to acknowledge how the provider may meet their cultural identity needs, and more importantly, acknowledge how the provider does not. Creating a foundation of understanding about how the sociocultural context of the provider is different than the individual can go a long way in fostering communication when they're struggling to stay engaged. Once you make the referral and the individual initiates treatment of any kind, your role is to provide support and help them when they're struggling. For those engaged in MOUD, this may involve challenges with medication compliance in particular. Throughout the individual's MOUD journey, you'll also be navigating a lot of moving parts. First, this includes potentially experiencing and addressing stigma from your colleagues about referring to MOUD, especially if they believe the myth it's drug use to control drug use. Think about your own evolution with MOUD and how your peers might be early in theirs. Don't let their early experiences distract you from making MOUD referrals. Additionally, there might be specific organizational policies that make working with an individual on MOUD challenging, such as mandatory reporting for illicit drug use. Module 6 will dive deeper into how to navigate this, but it's an important consideration when providing support to the individual you're working with. Second, as previously discussed, the quality of care a provider is or is not providing is critical to an individual's engagement in treatment. Before checking in with the individual about their side effects and compliance to treatment condition, ask them how they are experiencing care. If you know the individual has had previous discriminatory healthcare experiences, follow up on this related to their current MOUD provider. Checking in about medication compliance to treatment means considering the context in which they are or are not experiencing quality care. Once you understand the context of the care they're experiencing, then check in about medication side effects and compliance. Like any medication treating chronic diseases like hypertension, diabetes, or anxiety, it's important they're taking MOUD as prescribed. It's important during office, field, and home visits to check in about what's going well and what they're struggling with to stay compliant with their medication. Lastly, be on the lookout for medication diversion and return to use. Medication diversion occurs when someone legally prescribed medication passes it to someone not prescribed. Most importantly, medication diversion means the individual is not compliant with their medication. This can lead to serious withdrawals and potential overdose if they return to use. There are likely a few warning signs this is occurring. The individual testing negative for substances they should test positive for, the individual testing positive for substances they are not prescribed, or reported withdrawal symptoms. If you suspect diversion is taking place, it's best to reach out to the MOUD provider directly to discuss the issue. If diversion is occurring, likely the individual has returned to use. Opioid use disorder is a chronic disease, and this is the nature of the disease. Talk to the individual about what is triggering their return to use. It's important to elicit the context surrounding the drug use to more effectively tailor responsive support. And it will help the MOUD provider make more informed discussions about the treatment response. As discussed throughout this module, there are several times when you'll need to directly connect with the MOUD provider. This includes understanding their treatment eligibility and components of their treatment that will help you make a responsive referral. You'll also need to connect with them to understand if they conduct drug testing during treatment and how, if at all, they will share the results with you. You'll also need to connect about changes or worsening side effects the individual you're working with reports, and if they've had any changes to other medications or become pregnant. You'll also want to connect immediately about reported or suspected medication noncompliance and diversion. If someone is returning to use, it might be best to leave that conversation to the community provider. However, you'll want to let the provider know that this is happening. You'll also want to contact them immediately if the individual is arrested, as 1 day without medication can cause serious withdrawal symptoms. This may jeopardize their MOUD treatment and eligibility to remain with their current provider. You'll also need to contact the provider if the individual is revoked from probation and returns to custody. You'll need to get clarity on who is best to contact the jail to alert medical professionals about potential withdrawal and detox while in custody. Part of your role as a support for the individual is to communicate with the jail about their MOUD engagement and place the MOUD provider in contact with the jail. Lastly, you'll want to understand HIPAA and 42 CFR Part 2 regulations when it comes to community providers sharing information about the individual and their treatment. As discussed in Module 4, you'll want to check with your agency about existing waivers for protected health information, PHI, to know what the community provider can share with you about the individual's process in treatment. You should review any existing waivers or releases of information to ensure it includes the information sharing needed for MOUD. If your agency doesn't have any waivers in place, it's important that you consider putting one into place to increase the level and type of information that can be shared between you and the community provider. For more information about the role of the MOUD provider throughout the treatment experience, watch the companion Module 5, The Role of the MOUD Provider.